Doctors and nurses, what's your he shouldn't have survived story? Wound care director, nurse, specializing in wounds for 6 years now. Two wild wound stories patients shouldn't have survived. Patient A was a regular lady, little overweight, some mild hypertension, nothing crazy. Smart woman, worked a full-time job, aviation mechanic. Comes into my work with NF, necrotizing fasciitis, flesh-eating bacteria, deadly, gnarly crap. She had a 10% chance of survival. Her peritoneum was exposed completely. It had eaten her skin and soft tissues across her abdomen, all the way across top to bottom, around her flanks, the tops of her thighs, the top of her vagina, under her breasts. The wound measured about 7.0 centimeters by 120.0 centimeters, with a depth of 7.0 centimeters or so in some parts. After many months of wound care, skin grafts, and PT/OT, she walked right out of the facility, scarred, but completely fine. All of it started from a bug bite/cut in her stomach after swimming in one of the local lakes in our state. Patient B was a patient suffering from severe mental illness. Her and her mother also had mental illness issues, were living in a motel. One day, patient B up and decided she just, quote, wasn't going to walk anymore. She sat in the motel chair for roughly 45 days straight, urinating, defecating, not showering, etc. in this chair. Literally lived and sat in the same spot. Eventually, motel staff received complaints of foul smells. They called the fire department. Her flesh had rotted off, pressure injury that went necrotic, and was eaten away by bugs in that chair. When they lifted her off, her skin had literally liquefied into that chair. For obvious reasons, patient B and her mom became APS cases, and they actually became some of my favorite patients for many years. By the time patient B got to me, she had had multiple debridement surgeries, and she was left with a permanent colostomy and urostomy. Her wound was 20 to 25 centimeters deep approximately. She was obese. Imagine large butt cheeks just gone, down to the bone. I could put my arm halfway up my forearm in her wound and move them from side to side. It was easily 60 centimeters wide by 40 centimeters in length. Sacral bone exposed bilaterally, with the bottom 3 to 4 vertebrae exposed too. Both butt cheeks were gone. It was just a very deep hole, muscle and bone at this point. In 1.5 years, her skin grew back beautifully though. What I found amazing was the body's ability to grow back separate cheeks. LOL. I know that might sound odd, but from where it was, a massive hole, to two decent cheeks, the body never ceases to amaze me. Wound care, man, I got stories for days. Next story. Also not a nurse or doctor, but a couple months ago I had a serious skydiving accident in which neither my primary nor reserve parachute opened properly. The reserve wasn't even open halfway. Ended up with a shattered femur, open book pelvis, burst fracture on my back, and some broken ribs. I will not be skydiving again, but I will be able to walk. My wife is a flight nurse, and her fellow coworker saved my life on the helicopter. Next story. Finally, my time to shine. Hermatologist here. I deal with leukemias and lymphomas, unexplained anemia, that kind of stuff. My favorite story to tell is of a patient. Gonna call him Mr. X. Well, Mr. X is a 38-year-old patient who presented with a swollen abdomen, extreme fatigue, peripheral edema, and multiple enlarged lymph nodes. To paint a mental image, imagine a huge purple potato with toothpicks for limbs and inflated gloves for hands. Wasn't looking human at all. After a lymph node biopsy, the diagnosis came: Hodgkin's lymphoma, HL. Now, HL is one of the few curable diseases if treated correctly. 6 to 8 rounds of chemotherapy. However, the subtype was rather aggressive and with poor prognosis, so his chances were grim to say the least. One course of chemo is about a month, but seeing his status not improving after 2 weeks, half round of chemo, he wanted to be discharged to die in his bed in his home. So he calls his friend to pick him up, and off they go. 1 month later, a healthy-looking man, fit and groomed, approaches me and tells me he'd like to continue the chemotherapy because he's feeling great. I had no idea who I was talking to until he introduced himself as Mr. X. My jaw dropped to the floor, and I sort of rushed to schedule his next rounds of chemo. I asked him what changed his mind about staying, and he tells me that on the way home, about an hour on the road, he's got a weird appetite, so he asked his friend to pick up about a dozen cans of Spam, the European equivalent at least, and he just devoured them on the way home. Seeing that, his friend told him when they got home, "Well, X, if you can cram that crap in your stomach, I'm pretty sure you can take at least 2 more rounds of chemo." So there he was, the living proof that spam changes lives. So at the end of chemo, 8 rounds, he had what we call a complete response, CR. A CR that lasts to this day, 5 years later, pretty much equivalent to cured in his case. No idea why I feel proud of his accomplishment, but it's one of my favorite stories to tell. Yeah, so spam and red wine apparently is all you need to live a long, healthy life. Who knew? Next story. We had a guy come into the ER because he was feeling kind of dizzy and out of breath. They ordered a standard array of labs, and when we, the lab, drew his blood, we noticed that his blood seemed really thin and watery. That was because he had a effing 2.7 hemoglobin. For those of you who know hemoglobin values, I swear on my mother I'm telling the truth that this man was both walking and conscious when he came in. He even argued about being admitted overnight. We couldn't even get his sample to run at first. We had to F with the sensors for it to register. For those of you who don't know hemoglobin values, it's basically measuring how much blood is in your blood, and therefore how much oxygen is capable of being carried throughout your body. Normal hemoglobin is roughly 12 to 16 or so, depending on age and gender. Below 10 is where they start considering the possibility of transfusion, and below 8 is considered critical. A 2.7 should be dead. Edit 1. Since a lot of people have asked, the ultimate cause was severe alcoholism. His liver and pancreas were starting to shut down, so long-term alcoholic anemia coupled with poor diet led to his HGB dropping slowly enough that his body was able to adjust. He survived and was transferred to another facility after transfusing a few units, but probably won't live another 10 years because of the damage already done. Next story. Not a doctor or nurse, but my dad. In May of 2019, he got hit by a train on his bicycle. The police report said it was going 80 mph. When we got to the hospital on the first day, the doctors basically told us to prepare for his death. His blood pressure was dropping like crazy, but they cut a hole in his stomach, and that seemed to stabilize things for the first night. He woke up a few weeks later and had broken all his ribs on the right, some on the left, both collarbones, his right arm, collapsed both lungs, and had a traumatic brain injury. After he woke up in the ICU, he was acting pretty crazy. The doctors told us he would never return to his job or regain the level of intelligence he had pre-accident. Eventually, he left the ICU, went to general ward, and then 2 rehabs. He left the second rehab early. By August 2019, he went back to his job as a VP. His speech was still slightly impaired at this time. In December 2019, he bought a new bike. As of today, he seems completely normal. Long shot, but if you were one of the first responders for this accident, I would like to thank you from the bottom of my heart. Whatever you did on that first day probably ensured that he got to live. Next story. Guy came in with foot-long scalp lack, several abdominal punctures, and an 8-inch knife sticking halfway out of his sternum. Still talking to EMTs during report. He was worked up, stapled up, discharged that night after they picked up his brother for doing it. No punctures to any organs, no card or palm injuries, no intestinal perforation. I don't know how. I sent him to the OR. I was able to even consent the guy, which was surreal as I was on call trauma resident. An hour later, they said it was the right call, but they just did conscious sedation and pulled it out with anesthesia, and surgeons gowned and ready to intervene. And he was good for discharge as his police chaperone said it was safe. Next story. During my internship in a local hospital, there are multiple stories, but unlikely survival/outcomes, about people who, in my opinion, are immortal beings that like to spite God. Several cases have burned themselves into my brain, but there's one that takes the cake. A 31-year-old man was shot, then dropped at the local ER by the same guys who shot him. In total, he had 10 gunshot wounds across his thorax, abdomen, pelvis, and legs. The bullets went through almost every single organ and also broke a femur and a tibia. Needless to say, he was in hypovolemic shock and needed emergency surgery and blood transfusions. Look, I cannot tell you how much care has gone into his case. He spent 3 months in the ICU, and he's now at the surgery floor of the hospital. So far, he's had 25 plus surgical interventions, and counting, from 3 different teams and over 50 bags of blood. At one point, one of the teams realized they couldn't completely close his abdomen after one particular surgery, and decided to leave his abdomen open. And several surgeries later, he developed what we call hostile abdomen. The abdominal wall is scarred, and everything inside is topped up with fibrous adherences/tissue. To the point that going in for yet another surgery is a hellish experience. He's also had multiple infections. both nosocomial and from his own digestive tract. One bullet entered through the abdomen, pierced his rectum, and exited through one of his butt cheeks, and during the healing process, the wound became a fistula that continually dripped pus and mucus, riddled with bacteria, in and out of the abdominal cavity, to the point he fell into septic shock twice. Regular antibiotics weren't doing their job no more, so infectology had to be called in regularly as he needed, and still needs, one hell of an antibiotic cocktail. Although he's still not completely out of the woods, at least the surgeons were able to successfully close his abdomen. His infection is currently under control, and his legs are finally healing properly. If you ask me, he'll probably live, if the local gangs don't invade the hospital and kill him before he's discharged, because it almost happened with him a month into his stay. Next story. Nurse here. There once was a patient on our floor that I think was a gunshot victim. I never directly took care of him, so I'm not sure of the story or full course of events, but the dude was basically just a torso. I guess whatever happened to him, there was so much trauma or infection or whatever that the surgeons literally amputated everything from mid-abdomen and down. He had a few surgical drains and tubes to take care of functions like urinating and defecating because the parts that do that simply weren't there. It was absolutely effing wild walking past his room when I saw him. Imagine a human being that's literally just a torso, arms, neck, and a head. Place your hand on your belly and just imagine everything below that is gone. It was like some crap right out of The Walking Dead. Well, at least he still has his arms. When this story was first being described, I thought it was literally just like a head and a body. No arms, no legs, nothing below the waist. In that case, I don't even know if I would want to still be living at that point. That just sounds like a miserable point of existence. But interesting story. Thanks for sharing. Next story. I was a phlebotomist during COVID. I watched 6-ish people die in one single weekend in my ICU mornings. I was friendly with some. There was one guy left. I can still see his face. For 2 months, I drew his blood, and his wife, non-ICU COVID, for a month. I watched him get intubated, extubated, and re-intubated. I remember telling his wife whatever I could that wouldn't upset her. Oh, his blood pressure was almost normal today. Oh, his blood was so easy to draw today. The blood thinners seem to be helping lately, just not a lie about affirmation. I'd talk to him while he was out and tell him about his wife, how nice and wonderful she was, and how he had to keep going because she really missed him. Everyone thought he would die like the rest. He coded twice, at least during my shift, and he was only extubated for a few days before he was just really struggling. One day I came in after a weekend off and he's not there. I panicked and was told he was moved to the first floor, which was on my way for morning routine. I never had a quicker, more efficient day at work. I was determined to be the one to get to his room. He was sat up in bed chatting with me after 2 weeks. I told him about his wife and anything he asked, and I was legally allowed to tell him. He walked out of the hospital on his own. I have some similar stories from COVID, but we were all like, holy crap, I can't believe he effing lived. Next story. My wife, 34 weeks pregnant, went into the hospital for a routine appointment. Said she hadn't felt the baby move much recently. Said baby was probably tired and thought nothing of it. Doctor did an ultrasound, discovered placental abruption. Baby had to come out immediately by cesarean. Otherwise, baby would probably have died within hours, and my wife too. Result? Tell your doctors everything, folks, even if you don't think it's important. If my wife hadn't mentioned it in passing, she and my son probably wouldn't be here. I just want to take a second to reinforce that last line to anyone that might be thinking about withholding information. You do need to tell your doctors, your medical professionals assisting you, everything. Literally everything. The smallest details can be the difference between life and death, so this story is a perfect example. Next story. Patient here. Last year, I walked into the doctor's for a checkup and found that I had pretty much no red blood cells. Doctor kept me in the room an hour, asking me questions, and kept wondering how I'd managed to walk to the office alone, much less how I was standing in front of her and not collapsed on the floor. Apparently, I'd had severe anemia for about 5-ish years and was just living with it. Coincidentally, the year prior, my dog was in a similar place. We went to the vet because she was bleeding everywhere, and come to find out, her white blood cell count was literally 0. I don't know how either of us is alive right now, but I'm damn sure we're both happy to still be here. Next story. I don't see my doctor or my nurse in here, so I'll add my story. Many years ago, I was an overweight alcoholic. I'm talking 300 pounds and drinking quite heavily. My wife also was drinking right beside me, so things were pretty nasty. Anyway, one night, the drinking was far worse than before. We were out with friends, and one thing led to another. I thought we were having a grand old time, and the last thing I remember was taking one more bite of dinner. Roughly 24 hours later, I'm opening my eyes and realizing I'm not in my room. I'm in a hospital room hooked up to an IV and multiple machines. As I slowly come to, I make eye contact with my wife, who's literally bawling her eyes out. Before I even utter a word, she leaves the room and gets the attending doctor. He comes in, grabs a clipboard on my bed, and reads why I was admitted. BAC, 0.28. Blood pressure, 150 over 110. Blood sugar, 115. He tells me by all means I should be dead, and that if I don't get my crap together soon, I will be dead. Once discharged, I did get my crap together. I lost the weight, I'm now 185 pounds, gave up alcohol forever, and much, much more. I am truly a lucky man. Next story. Not a doc/nurse, but was volunteering at the time. I was sitting with a cancer patient who came through ER because of complications with their chemo treatment that day. I heard over the radio that EMS was coming in with a code. No sinus rhythm, no heartbeat, no pulse, and no blood pressure. It was a classic dead on arrival scenario. They bagged them and eventually trached them. Nothing worked. The doc called the time. My cancer passed at almost the same time. Due to the complications, I went down to the hospital morgue to pay my respects. After about 10 minutes of me crying over this child, I heard banging from one of the freezers where the bodies were stored. Night of the Living Dead ran through my mind, but I put my fear aside and opened it. This guy was alive and breathing. I almost passed out. I hit the panic button and all hell broke loose. Docs, nurses, and security was in the room in less than a minute. This guy had two of the rare conditions that would cause their heart to slow down so much that it was undetectable by pulse ox, while also the signals from his brain to his heart would cause a false negative on an EKG, basically leading to a fake death. Next story. VA hospital in Oklahoma City, winter 1986. A 68-year-old black male went into cardiac arrest on the med-surg floor, and Code Blue was called. Another second-year student and I arrived on the scene with our interns and probably 20 medical students. Everyone got involved and had a chance to do CPR. Every medication in the crash cart was used. After 60 minutes, much longer than a code would normally be run, we were just showing off our knowledge and skills to our medical students. Seeing a weak, pulseless rhythm, I decided to do a pericardiocentesis, draw fluid from the sac around the heart as treatment for a possible tamponade. I removed about 20 to 25 cc's of a clear fluid through a 6-inch needle. The other resident said to me, that wasn't enough to do anything. Immediately, we had a measurable blood pressure and the patient was sent to the ICU. Over a year later, I was caring for a very ill woman at a university hospital across the street. Her well-dressed, articulate father came by to visit her and we got to talking. He said, I was real sick at the VA about a year ago and those doctors saved my life. I realized it was the same man and was glad we hadn't given up too soon. You never know. Next story. Not a doctor or a nurse, but me. 10 years ago to the day, actually, I woke up from a month-long coma due to an anoxic brain injury. Had zero brain function and the neurologist was trying to get my wife to pull the plug. This is the definition of brain death, he said. We can continue to keep him alive, but eventually an infection will kill him. The doctor's exact words, which were seconded by the rest of my care team. Luckily, my wife, who has an amazingly strong personality and all-around badass, said a big F you to those doctors, moved me into a long-term acute care hospital. PT started moving me around, and what I can only assume was a weekend at Bernie's type situation, and in the immortal words, I got better. Next story. Young man, early 20s, electrician, working on the roof of a 3-level new home build. His boss didn't supply harnessing and he fell onto a concrete pad below. Broke every bone in his face, both wrists, and one forearm. I didn't meet him until 3 days later on the orthopedic ward where the nurses were calling him the boy who lived. One of the Harry Potter movies had not long come out. Honestly, he should not have survived, but he did by some miracle. His young wife was equal parts terrified and furious. Next story. Neither a nurse nor a doctor, but an EMTB working for a county 911 system. I was a crew of 2. Both of us were EMTBs. We received a call for a 40-something male having difficulty breathing and some chest pain. Once we arrived on scene, we walked into the door to his kitchen, where he was sitting in a tripod position at the kitchen table about 15 feet from us. He was audibly wheezing and said it was really hard for him to breathe. Assisted him onto the stretcher and into the ambulance, gave the patient O2 and placed him on a 12-lead BP cuff and pulse ox. Transmitted it to the nearby hospital and radio dispatch to try and have a paramedic unit meet us en route. Wasn't able to, so we made it to the hospital in about 5 to 10 minutes. When we transferred him from our stretcher to the hospital bed, he went into cardiac arrest. After the first round of CPR and cardiac drugs, they were able to sustain a pulse. After a few hours of running other calls, we were at the same hospital and the doctor said that patient had a pulmonary embolism, widowmaker STEMI, and stroke, on top of him coding. As far as I know, he survived. Next story. My wife, 47 years old, in great shape, walking 7 miles a day, complained of stomach cramps. Diverticulitis had narrowed her colon, so her poop was nothing more than a thin ribbon. She didn't discuss this with her PCP, primary care physician. 2 days before Christmas, she came home and said she thought she had the flu and just wanted to sleep. When she was changing, I noticed her swollen belly. Her normal washboard stomach looked 5 months pregnant. I took her to the ER as that isn't right. ER backed up with major holidays and possible flu gets the bottom of the triage list. The nurse kept asking, how many months pregnant? She had a full hysterectomy, so that was not possible. Explained rapid change to her belly. 14 hours pass. Finally get her x-rays. Radiologist notes full of air, ruptured colon, and she just says doesn't feel well. Fully septic. The ascending colon was removed, and an ileostomy was fitted. Sepsis shut down everything, and her heart kept pumping. She coded numerous times in recovery. One tough lady, and crazy 24 hours with hers after surgery. Hospital folks would tell her she was the Christmas miracle. Still amazed she's still with me 17 years later. For the longest time, she kept asking her surgeon, what's the typical recovery time? And he deferred the question. She had an additional 7 surgeries, so we got to know her surgeon, and he finally admitted, you're the only one who survived a total septic shutdown. Next story. Back in 2020, I was part of a clinical trial. As such, I got bloods drawn about every 2 weeks. Everything seemed normal, except I was bruising more than normal, but didn't think anything of it. Ended up getting a call from the lab later that day telling me that if I saw any more bruises pop up in the next 24 hours, to go straight to the emergency room. Apparently, my blood work showed that I had absolutely no clotting factors at all. They canceled all blood work for a month, and somehow my next routine blood draw came up fine, other than some routine anemia. Next story. Not a doctor or a nurse, but was there for the whole process. My husband was hit by a car going 40 mph and thrown roughly 20 feet forwards. The first I knew of it was a ring at the doorbell where a chap says, I'm with the ambulance and have your husband in the back. He'd forgotten his mobile phone and asked the ambulance to take a detour to let me know what was going on. So I jump in the back and he's a mess. Bleeding head injury, road burn on every possible part of him, strapped down to the gurney and a neck support. When he was thrown forward, he must have rolled on every side. He had road burn on his hands, face, front and back of arms and legs, his butt and his stomach. He was rushed into an MRI because they were concerned about the head injury. Nothing. MRI on his abdomen to check for internal bleeding. Nothing. Full body x-ray. Not a bone broken on his body. He needed stitches, but the doctor who saw him literally said he couldn't believe he wasn't more injured. The only thing he could think of was that he must have gone like a rag doll when he was hit, and the lack of tensing saved him from more serious injury. Honestly, if you'd seen him, he looked like he shouldn't even be walking, but all his scuffs healed up and he was absolutely fine. Next story. Not a perfect response to the question, but too funny not to tell. Woman, big woman, shot 13 times, all flesh wounds. She says, quote, I'm never going to a family reunion again. I was like, you got shot at a family reunion? She says, yeah, and the same thing happened last year. She had been shot by a different family member and hospitalized the year before. Look, I'm sorry, but if you're batting 1,000 at getting shot at your family reunions, I think it might be time for a little disownership there. You can make reality TV out of stuff like this. Next story. Fireman checking in here responded to a shady hotel a town over for a man throwing up. PD passed us on the way and we thought nothing of it because it's a shady spot. Get on scene and PD says the guy ain't breathing. Me and my officer start compressions while the ambu gets on scene. Now, the ambu was expecting a man throwing up, but unfortunately, all of the 800 MHZ radios in the northern part of our state were down. They had no idea what they were responding into. Standard procedure is another engine gets called for CPR, which was unable to happen because we couldn't contact dispatch. Ambu crew pumps this guy full of drugs and gets an auto CPR machine on him. Standard procedure is 30 minutes of on-scene CPR in this state. but because the clock was set late, we couldn't contact dispatch. It ends up being around 45 minutes of CPR with no resuscitation. As we're loading this guy into the ambu, we find out he has a lower GI bleed and has been bleeding excessively out of his anus. So, to recap, radio failure causing miscommunication. Patient was possibly using narcotics, 45 minutes of CPR with no pulse, and has excessive blood loss. Prior to getting this patient into the back of the ambulance, the medics put on a 12 lead. Basically, it's a way to graph the heart's rhythm using wires connected to different parts of the body. The graph is showing this patient has a shockable pulse in the back of the ambu, and the medic decides, F it. Anything else we can try, we may as well. Medics turn off the auto CPR, shock the patient, and to all of our bewilderment, the graph shows an extremely weak pulse. The medic puts his finger against the patient's neck and says he can feel it. The pulse gets stronger and stronger. The medics gave him nasal Narcan, and he starts breathing on his own. I have no idea if this patient was alive when he came out of the hospital, but I know we did everything we could for him and got him alive when he arrived. Next story. Hi, I'm a third-year resident internal medicine. I have a lot of examples where patients should have died or were expected to die during the last 3 years. What stuck out for me was a patient in my first year of residency. He was a 63-year-old male who came to the emergency department because he had trouble with his breathing. He had just walked 2 kilometers to the hospital, rural. This was in peak first wave COVID time, but patient was noticed immediately because of an oxygen saturation of 64% in oximetry, which in a healthy adult should be over 94%. Most people with a value of 80% or less are dead or in ICU on a ventilator. I saw the patient after a few minutes and suspected COVID, for which he tested positive after a rapid test, but also diagnosed him with a massive myocardial infarction. I'm pretty sure that he would have arrested due to an arrhythmia if he had waited to come to the hospital for 1 to 2 hours. He was intubated, put on a ventilator, and had 2 new coronary stents within an hour. Took him 2 months to recover, but he survived. Next story. Nurse here. PT came in for a CT scan. Was intubated with the rhesus team. Turns out his motorcycle had smashed into a tree and his helmet had dug into his head and caused a significant skull fracture and TBI. The anesthetist pulled up the gauze on his head so I could see his brain. The irony being his helmet caused the damage. To be fair, he would have lost his head without the helmet, so... Next story. About a year ago, I got some blood work done because I feared I may have misread the directions on one of my medications, resulting in a day of ODing. Not a lot, but enough to throw my potassium levels out of whack. I got the results later that day, and they told me I needed to get to the ER ASAP. My potassium was critically low. The doctor even told me he had never seen anyone with such a low level and was still alive. Next story. Was a firefighter a while ago and heard this from the EMTs. Basically, they had picked up an extremely intoxicated native Alaskan guy wandering around in negative 30 degrees in shorts and a t-shirt. Turns out he'd been wandering for hours and hours and had severe hyperthermia and should have been a popsicle. The kicker is when they did a blood alcohol test, he was 3 times the limit it takes to die from alcohol poisoning. They believed that the only reason he didn't freeze to death was the alcohol acted like antifreeze and stopped his flesh from fully freezing. Next story. Not a doctor or nurse, but I would like to share my mother's amazing story. Back in 2008, I was a senior in high school. My mother was the glue that held our little family together. Our little family consisted of my dad, mom, little brother, and myself. One day, about a week before Valentine's Day, my mom started complaining of a headache. It wasn't out of the normal because my mom got bad headaches for as long as I could remember. She was a tough lady and just always pushed through her headaches she had. This one was different though. She was sensitive to light. She didn't really have an appetite. And she said keeping her eyes closed helped. This headache went on for about 2 days before she decided to go to the ER. The doctor at the ER told her she just had a head cold and prescribed some OTC medicine, which happened to be Mucinex. We took my mom back home and gave her the OTC meds the doctor told us to. Well, a day later, she started getting worse. The pain in her head was so bad that she just wanted to lay in bed with the room completely dark. We ended up taking her back to the ER and she saw the same ER doctor again. Once again, he told her she just had a severe head cold. He did not run any scans or tests. So again, we took her back home. Mind you, even though she was in great pain, she still got up and walked on her own and was still talking normally. Like I said, she's a tough lady. Well, after another day or so went by, she still was not getting any better. She was consistently getting worse and worse. Finally, we talked her into going back to the ER because this whole situation was scaring us. This time we saw a different doctor. When he walked into the room and seen how my mom looked and seen how much pain she was in, he immediately wanted her to do a CT scan. We were not prepared to hear what the doctor was going to tell us. He said she had a bursted brain aneurysm deep in her brain, that her brain was in fact bleeding on the inside. The look on his face I'll never forget. He was pale as a ghost because he said he's never seen or heard of anyone living with a bursted brain aneurysm. He couldn't believe she was up walking around and still talking. He told us she should be dead. We were in shock. My mother had been dealing with this for a whole week. The doctor and nurses prepared my mom to be taken by helicopter up to OKC to see one of the best brain surgeons in the state and have immediate brain surgery. However, when they got her to OKC, she ended up having a massive stroke. This is what they were trying to avoid happening. The stroke affected her vocal cords and the right side of her body. Once again, she lived through all of that. And she still hasn't had her brain surgery. Once the brain surgeon explained to us how this surgery was going to go, my dad had to sign a paper giving his consent that it was okay for my mom to be legally dead for just a few minutes while the surgeon clips this bleeding aneurysm in her brain. It was the only option considering he had to go deep into her brain. The surgeon had the means to bring her back to life once he finished the procedure. It was one of the hardest things my family had to go through. We didn't want to sign a paper that said we were okay with my mom being legally dead for a few minutes. No one wants to sign a paper like that. This woman has already been to hell and back and is still alive, but it was the only way to save her life. She made it through the 8-hour surgery so beautifully. The doctor said it couldn't have went any better. My mother had to be in ICU for over a month. It was painful to see her in the state she was, but at least she was alive and still here with us. After the ICU, she went to 2 different rehab facilities. She fought hard to learn to walk again, and it was heartbreaking I wasn't able to hear her old voice again. She couldn't speak very well since the massive stroke. Plus, they ended up putting a trach in her throat. Fast forward to this present day. My mother is still very alive and well. She's been on a long journey over the years. The doctors all told us she might not make it 5 years after she had her brain surgery. 14 years later, she's still here and doing better than ever. She walks and exercises every day. She does everything for herself. She cooks, cleans, and can even drive. Her voice isn't 100%, but I can understand her just fine. Her health has never been better. She truly is a miracle on this earth. I look at her in amazement every day. Next story. Operating room nurse here. One patient had cancer affecting pretty much their whole abdominal cavity. She was young with small children and just wanted one more holiday season with them. There was just so many buckets of organs and tissue in the room. When you looked into her abdomen, there was just nothing. I'll never forget seeing just a gaping hole. They left her with enough functioning pieces of organs to get her through Thanksgiving and Christmas. I left my badge at home one day and my boyfriend was bringing it to me. He was parked outside of a back door of the hospital waiting for me. It looks like that area could be regularly used entrance, but it's not. He called me and told me someone had just dumped someone out of car at that door and they were just laying on the ground. The ER came up and got them, and then later that night, they became my patient in the OR, necrotizing fasciitis down their whole leg, and had tried to deal with the pain by shooting up a little too much heroin. Thankfully, I got my badge that day, or who knows how long they would have laid there ODing. First day ever in an OR, patient not wearing a seatbelt, speeding, crashed, went through the windshield. Broken legs, shattered pelvis, broken arms, broken ribs, broken sternum, broken nose, etc. Looked like every part of the body was broken. I had to stand behind their head, pulling their shoulders back so they could plate and screw their sternum back together. Was on a trauma floor before the OR. It's a lot of motorcycle accidents and gunshots, but the most memorable was a patient who got shot in the head and was missing a chunk of their head on one side, including half their skull. You could see the brain pulsating with each heartbeat. Super nice person, too. And amazing to be able to have a conversation with someone missing part of their head. Next story. Not a doctor, but I've got a story anyway. It's both a I shouldn't have survived and a I shouldn't have recovered that fast sort of story. So about 2 months ago, I, 27, male, otherwise healthy, walked into the ER complaining of lightheadedness and chills while COVID positive, and died an hour later in triage. What they quickly discovered was that I was in shock, renal failure, and liver failure. My blood pressure map was 43. My O2 sat was 80%, and I was severely hypoglycemic. What actually put me on the floor, though, was hyperkalemia. super high blood potassium, which triggered a cardiac arrest. After about 20 minutes of CPR, they brought me back, put me on a vent, dialysis, and 3 blood pressors, and then promptly forgot to tell my wife that anything had happened. Over the next 3 hours, my blood pressure refused to increase, and they made the decision to med flight me to Mass General so they could put me on ECMO, a type of life support that oxygenates and pumps blood for you. It's considered a last resort, and the chances of coming off ECMO alive are 50-50 at best. When I got to MGH, they determined that I didn't need ECMO yet, and tried to keep me stable enough to avoid it. And what was described in the doctor's notes as a miraculous overnight turnaround, I recovered enough to be taken off the vent, off the blood pressors, and out of the coma the next day. What we now know is that I have a rare genetic condition known as Addison's disease, primary adrenal insufficiency, in which my body doesn't produce cortisol. Turns out cortisol, being known as the stress hormone, is a bit of an undersell. It performs critical self-regulating functions in nearly all systems of the body. When I entered the ER, I was in a condition known as an adrenal crisis, where my body needs more cortisol than it has to spare, and systems start shutting down because of the lack. Thankfully, part of the care given prior to my med flight included stress dose steroids, one of which was hydrocortisone, aka synthetic cortisol. Turns out, 100 mgs of one thing your body really needs is enough to turn you into a case study. Apparently, my story is being used as a teaching case at Mass General now as a way to educate more people about Addison's disease. Next story. I've told this story before, but I will never not be astounded by it. C1 dislocation lady. She was in a car crash earlier that day, checked out by paramedics at the scene and cleared. A couple hours later, her head really hurt, so she was told to go to the ER. Walked in with her skull quite literally not attached to her spine. In 99.9999999% of cases, that's instant death. How she managed to survive many hours with her head detached from the rest of her body, none of us will ever know. Next story. Me. This all started a week back. I was supposed to get my wisdom teeth out this Friday. I'm 23, quite old, but they've been bothering, no biggie, get them out and they're both done with, right? Well, I began to not be able to open my jaw, so I went to the ER and they were confused, as was I. So they gave me antibiotics and pain meds, and I was on my way. A couple days later, my face was so big, so sore I had to go back. Well, turns out the doctors that were too lazy to run tests, I hold no shame towards them, I know it's a busy field, but the ones who did find out I had 3 massive abscesses in my mouth, which usually aren't a big deal, but I can't open my mouth, so when they put me under anesthesia, they have to breathe for me, which was a real pain. Luckily, I survived the surgery and I got 3 drains on my face now. If someone can show me how to post a pic, I will. Pretty gnarly. Regardless, if you feel something is wrong, don't hesitate, because they say if I waited any longer, I wouldn't have made it. Next story. I know you said doctors and nurses, but I'm a firefighter. Here's my story. We got called to a MVA involving a structure. Car went into a building, but one of the support beams came down on impact, causing the front of the car to pin the guy in, crushing everything from the waist down. The medics thought crush syndrome. He ended up losing his left leg, but he made a full recovery. Next story. Nurse here. When I was a young lass, I had a patient in home care with diabetes that she pretty much ignored. She got a minor wound on her foot, and I really tried to convince her to see her MD, because diabetes. She brushed me off until the day she simply collapsed. No, I couldn't have done anything prior. I helped her take her insulin, but she refused any further help, and I only saw the wound on her foot once. She spent 3 months in an induced coma in my country's biggest and most advanced hospital. One leg got amputated at the hip. On the one she had left, the heel of her foot was one big black necrotic lump. It just fell off one day. On her shin, there is a 15 centimeter by 5 centimeter bone-deep wound, where I could literally see her tibia. Her butt got abutted as well. The whole thing is in everything from her lower back to her thighs was gone, including the last part of intestine. That resulted in her getting a stoma, but due to her condition and her being a rather big lady, they had to try a couple times, so she had a first deep hole on her upper abdomen. She could, and actually did, use it as a cup holder. So I had the pleasure of taking care of her wounds. The one where her butt used to be wouldn't heal due to infection and her diabetes. They tried everything from skin grafts to fish skin, and I had to take care of the bugs that was used to clean the infection. They come in little gauze bags. It's not like you just sprinkle them on the wound, and they're really expensive. So her primary MD from the hospital showed me a small trick, so to speak. You see, they have to be swapped pretty frequently, making the treatment even more expensive. The reason you have to swap them is that when they aren't hungry anymore, they stop eating and start to turn. But if you're quick, you can get them before they turn, and then dump them into a greater than zero point 0.9 HTO NaCl, and they'll start to puke, get hungry again, and can be reused. That's, of course, a big no-no. To top it all off, she got some pretty massive brain damage and got out of bed 2 to 5 times a day since she couldn't stand up or sit down. She somehow survived in spite of her continuing to ignore her diabetes, but she took it all with good humor and was pretty pleased with her new cup holder. Next story. Eye doctor here. This is more of a survival story of a patient, and it was 20 years ago while working in an NYC clinic. Ex-cop during examination, I notice he has a sort of gnarly left side of his face, and he takes off his hat, rather sizable crater missing from the side of his skull. He proceeds to tell me that he was shot in the chest and that the bullet fragmented off his vest. One of the fragments went through his cheek, through his left eye, through the brain, and then exited his skull, taking a chunk of bone with it. I couldn't wrap my head around it until I examined his retinas. Sure enough, entry wound, perfectly round scar, a lateral trail through the vitreous, and a perfectly round exit wound. The eye was in otherwise perfect shape. Correctable vision was 20/20, so the guy gets a bullet through his face, eyes, and brain and survives it. Bananas. Next story. Obligatory, not a medic, but a first aider with a few certs. Cannot stress enough, I can basically treat 2 things with a 100% success rate: splinters and surface wounds. Guy collapsed in the beer garden of the bar that I work in. He hadn't been a customer, and as it was a foul day, we had no idea he was out there until a lady passing the pub spotted him and told us. I've never run so fast in my life. He was entirely unresponsive to verbal, physical, and pain stimuli. He had aspirated vomit. I could hear it bubbling as he choked on it. When I got him on his side and got his mouth open, an absolute cascade of blood and vomit hit me. He'd bitten his tongue pretty much off from what I could see. His pulse was erratic, and I could hear him choking still. Pupils blown to crap and not responding. Stops breathing. He's literally turning gray in front of my eyes. I was doing CPR for about 5 minutes till the ambulance came, whilst he got grayer, and I was 100% convinced I was beating a dead man. They took him away. I threw up, cried, threw my clothes away, and borrowed stuff off my boss to get home. Was shaking like a crapping dog. Resigned myself to never knowing what had happened, as he obviously couldn't give me a name and had no ID on him. Month goes by. In walks a dude nobody knows. He's looking for the landlady. They got her, then she phoned me, and I walk in. It's the guy. He'd been having a bad time, wound up ODing on heroin and coke. Couldn't remember a damn thing, and all the hospital had been able to tell him was where he'd been found. He'd been on a vent for at least a week, and technically died twice, apparently. He brought me flowers, and I ugly cried for most of the rest of the day. I was absolutely convinced he died. Next story. I had a great uncle that for years lived with chronic back pain due to his job. He got a settlement, but his back got so bad that they had to put him on a morphine pump. 2 times he went to the hospital with pneumonia in the 2010s, and each time he survived it. He finally died this year in February at 82. I always joked with my grandfather that modern medicine kept him alive as long as possible. Next story. When he was 7, his leg was cut up from a boat propeller. He has a giant scar, but legs still intact. My stepdad was SA'd when younger by 2 other boys, and his parents knew and never did anything. Anyways, that affected him growing up, and he started doing drugs, ice specifically, to cope with it. He had not slept for 15 days. Of course, the worst happened, got into a car accident, crashed into a tree. A windshield wiper went through his eye, guts, and back ripped open, throat open, and his dog that was in the back of the ute survived. No injuries for the puppy, thank God. Anyways, he died like 3 times. He has no spleen, of course, LMFAO, but this story still shocks me thinking about it, and I've seen the images too. Effing graphic as F. I think like a few years ago, he nearly died because of scar tissue wrapped around his intestines. Also, this story makes me emotional because the dog I mentioned. Well, when my stepdad got back up and walking, which was 6 months later, he went to look for his dog and found out some old lady had him. When he went to her house and she answered, the dog was there and the dog obviously noticed him and was happy. The lady laughed and was like, "Wow, he really likes you." And my stepdad asked, "Where did you get him from?" The lady responded, "Believe it or not, my husband passed away the day this dog came to me. I know my husband sent him." My stepdad kept it together and looked her in the eyes and said, "He's a beautiful boy. Please look after him." And then sent her like a 1K check and his favorite food. He cried so hard telling me that story. I do too, telling it. He might look like a prick, but he has a good heart. Next story. Patient came in as a STMI, acute heart attack. Took them to cath lab for PPCI. Found he had a completely occluded left main stem. It supplies blood to about 70% of your heart, if not more. The patient didn't look particularly ill, but was one of those I thought it was just indigestion people. Their right coronary wasn't small, but it wasn't huge either. Most people who block their left main stem have cardiac arrest and die. Next story. When I was a resident in the cardiac ICU, we had a guy come in who had had a heart attack while driving. The problem was that this was a big heart attack and he went into cardiac arrest. His heart completely stopped, also while driving. So essentially he died while still driving his car, which of course crashed. But by the miracle of bystander CPR and medics who were very good at their job, this guy got a pulse back, made it to the hospital, and eventually woke up and at the end walked out of the hospital. Craziest thing I've ever seen. Next story. Not a doctor or a nurse, but I got hit by a Jeep as a pedestrian 2 years ago. They were going over 20 mph and hit me in the middle of the handicap parking spot in front of the front door of the building I was walking into. I flew 14 feet and broke 6 ribs. I've had a persistent whiplash since, and my left arm, dominant one, has neuropathy, and I've lost most of my coordination. I walk with a limp now and have neuropathy in my left foot since the Jeep hit my left knee first. There's a video of it too. Pretty effed up. Everyone I know has the video too, so I've constantly had to relive it, especially at work. Next story. A friend of mine was in a tractor accident as a kid. The tractor rolled, threw him from the seat, and then landed on top of him. Somehow he survived, went through nearly a year of surgery and physical therapy. By the end, he had to have his scalp, sternum, jaw, shins, and one of his forearms replaced with titanium. I called him a cyborg because he would show off his titanium parts by having people punch him in the chest or by shoving his head through stuff. He ended up at the hospital while I knew him because someone tried to fight him and broke their hand on his skull. He took the guy to hospital since he couldn't drive himself. Next story. Not a medical professional, yet, halfway through school, but as a scribe, we had one guy who tried to sneak pills of morphine into jail through his prison wallet, or a synthetic derivative of it. I can't remember specifically, and it was years ago. 3 of them popped, and he was exposed to about 200 milligrams of morphine/opiates at once, rectally increasing the bioavailability and thus absorption. For reference, normal practice for an adult is 10 to 20 milligrams every 4 hours. He came to us completely out, and it took us 3 shots of Narcan to bring him back. He woke up during the catheter placement, ironically enough. Next story. Was a patient a few years ago. Was on VC with a friend gaming, and in the middle of gaming, I started having a real tough time breathing, and my chest hurt a lot. I started to cough a lot too. Was not sure why, but decided to ignore it. For about a week, I went on with life as if nothing had happened. I've had something similar happen before, and the doctor said I was fine. Well, after about a week, my parents convinced me to go to the doctor. Once there, they took an x-ray and check-up, and told me to get to the ER immediately. The DR told me I had a pneumothorax. I was not aware of what that was, but walked 5 kilometers to the hospital. There, they told me it was a collapsed lung. My whole right lung was deflated. I was discharged the following day after they patched me up. Not sure how close to death I was. I do know that a collapsed lung can be dangerous, though. Next story. A chap with blue feet. At the height of COVID, before we really knew what we were doing, I was called into a care home with around 15 elderly residents. All but one had tested positive. All the staff were testing positive, all except this one resident. It was a grim day where we palliated a couple of staff to hospital very unwell. I was asked to check this guy's feet out. Myself and my colleague stood at the door not wanting to get near him. He was the only person in the whole building. I went back there a few weeks ago. There he was, watching his TV. Feet are still a bit blue, but he never got COVID. Next story. I'm an MA, but still counts. Long story ahead because of explaining mostly. I work in cardiology. Heart. The aortic valve in the heart is the valve that pushes blood that's oxygenated from the lungs into your body. It's also very susceptible to infection. Like viruses, most common back in the day, was rheumatic fever. It can become narrow, or in medical fields, stenosed, from an infection, but can be replaced, although it's still susceptible to infection, so someone has to have a full workup to make sure they don't or won't have an active infection. To the story, young patient has to have valve replacement. Healthy, so open heart is recommended. Has procedure, all is good. Healing good, but then messages us about a small spot on the wound. Advised to keep watching and let us know if it gets worse. Eventually the spot opens up and doctor takes a look. While it didn't seem too bad, the wound actually tunneled. Instead of being a big open wound, it was small but went deep. It was bad enough that it affected the sternum, bone that's in the center of the chest holding the ribs. The patient had to actually have sternum taken out to stop infection. This means their chest is completely without protection, mainly the heart. Even a slight bump can send their heart into a deadly arrhythmia. Patient is alive and well today after infectious disease intervention. I believe set for titanium to protect the chest once the infection has been clear for a bit. I still don't know how they managed walking around without any protection for their heart, though. Next story. Not staff, just the patient. All my life I've suffered with many mental illnesses at the hands of severe trauma and heritage. I was in an extremely deep depression at the time, and on December 12th, 2021, I decided I was done and I couldn't do it anymore. My mother had a lockbox with the medication inside due to previous attempts to end my life with an overdose on medication, but I know the code to the lockbox because of my mother's immaturity and forgetting to lock it while crap-faced in the past. I ended up taking almost half a bottle of Xanax, 7 of my Adderalls, 12 Lamictals, 4 gabapentin, 9 trazodone, and a crap ton of pain relievers, Benadryl, Tylenol, ibuprofen. Suffice it to say, my small body couldn't take it, especially with some of the physical conditions I suffer from. I had taken them and gone to sleep, and I was unresponsive in the morning. Ambulance was called, hauled off in the hospital. They could barely keep me awake, and I was delusional almost the entire time since I was absolutely buzzed on the Xans and Benadryls. My mom and grandfather were constantly in and out of the room since there would be only one visitor at a time. I was in a catatonic state for about 2 days, and my heart stopped beating about 4 times. My liver almost failed, and same with my kidneys. I finally recovered about 5 days after and was fully awake by then. When I could finally get out of bed, I had to be walked around because I could barely get control of any part of my body and had to write on a notepad because my speech was not intelligible in the slightest, and the writing was barely legible at that. I got mild brain damage from that and still have some motor problems in my legs and occasionally slur my speech or mix my words together. It's not like my mental health problems are much better, but I'm slowly making progress, so that's cool. I commend all the health workers in the comments here for doing what you do. Thank you. Next story. NAD, but my mom is one of these stories. I live in a pretty rural town right under Alaska. My mom was overworking herself. She works at a crappy company that can't keep employees because the boss is a tyrant. She literally worked a week straight. 3 hours of sleep a night, maybe, and after years of letting work ruin her health habits, she got a hole in her intestinal tract. Fast forward to when she's getting sepsis. She goes to emerge because she's feeling awful. The doctor, who's notoriously a POS, everyone in town despises this guy for legitimate reasons, says, if I didn't know any better, I'd say you have a hole in your intestine somewhere. But that's impossible. The pain alone would make it impossible for you to walk or move. He releases my mom with I don't remember what, but it wasn't antibiotics or anything. He gave her pain medication, which made her stool harder. Fast forward another 2 effing weeks. No, you can't make this crap up. My mom is a medical wonder, and she's so septic she's gonna drop. She's at a vessel trying to do her job when she knows she's gonna collapse. Calls her boss, tells her she's leaving now. Boss tries to protest, but understands eventually. My mom drives back to emerge, half passing out, half screaming in agony. They medevac her to Vancouver. What they saw in the x-ray, they couldn't handle up here. So while stool was leaking from my mom's body cavity, her body did this really unusual thing to survive. Some people's bodies make calcium to block off stuff. My mom's body made a bunch of scar tissue. Her intestines, ovaries, and her body cavity all fused together in a bid to cut her other organs off from the infection. They pulled people out of retirement to see what her body did. Nobody could believe she was full septic for 2 weeks and kept working 18 plus hours a day. It took a while to get her stable, but every one single specialist, nurse, doctor who was familiar with her case couldn't believe she survived. To this day, she still has trouble. She can still poo, but they had to shut her ovaries off. Even with an MRI, they have a hard time making heads or tails of what her lower gut is and isn't. So whenever she has pains or is worried something is going on, they have to use a scope camera. Next story. Former L&D nurse here had a patient being induced with Pitocin. She got her epidural and everything was going great. She was a bigger lady, so keeping the baby on the monitor could be trying at times, but mostly I was able to keep a decent reading. Noticed while I was in adjusting the pit that I had a lot of artifact in the US, so I went to adjust it and the belly just didn't look right. I immediately called for the midwife and OB, military hospital, and thank God we almost always had both during night shift. She had a uterine abruption. The baby was free-floating in her abdomen and the woman was actively bleeding. Emergency C-section immediately. From the time I'd seen the monitor go wonky to the time we had that baby out was maybe 7 minutes. Both mom and baby survived. Next story. Not a nurse or doctor, but the amount of reactions I get talking about my dad. Man. He was 53 at the time, no high blood pressure, no heart problems. Woke up with severe pain in his stomach. We all thought it was a hernia. Cue ER visit. He walked in, said he needed a doctor immediately as the pain was getting worse. They dismissed him, told him to sit down. He slammed his hand down and said, "Now." Nurse looked up just in time to see him crumble into a nearby chair, all gray and ashy. Nurse takes his blood pressure and pulse and cue a whirlwind of action. Turns out he was having a full-blow type A aortic aneurysm. The pain in his stomach was from blood pooling into it. Blood pressure was 43, and doctor said if it doesn't rise, then that's that. Heck, even the surgeon just shrugged when it did magically rise and they wished him off to surgery and said, well, I'll pray. 14 hours of bypass and open heart surgery, one mechanical valve, and a pacemaker later, he lived. There was 10 days after in the ICU, which was scary as all of his roommates died. Every time I'd go visit, someone else was dead. He was the last man standing.